I can peel back my foreskin when it's soft, but it's a bit painful when it's hard. I don't know if this is bad. This is one of many messages that I've received recently. Here's another one. Hey, Dr. Suj, when I'm not erect, my foreskin does retract. When I'm erect, it doesn't retract at all. Is that normal? And then I've received countless other messages that are similar to these. There are several things that could be going on if this situation is happening to you. The first would be a phimosis. This is where you have a really tight foreskin where you can't retract it over the head of the penis at all. If you're under 10 years old, then not a problem. It's expected at that age. Please do not forcibly retract the foreskin. If you're over 10 years old, doesn't matter how old, whether you're a teenager, whether you're 30, 40, 50 years old, if you can't pull your foreskin back, please go and see a doctor. There are things that we can do to help treat this. We can give steroid creams, which helps to reduce any scarring around the head of the penis and allows the foreskin to retract. We can recommend some gentle stretching exercises. Please don't forcibly retract your foreskin, and definitely don't do that if you're prepubescent or a teenager. And then if necessary, we can do a circumcision or a partial circumcision. There is also a procedure called a preputioplasty, which is where the foreskin is widened without the need for a partial or a full circumcision. If you're not able to retract your foreskin when it's erect, but you are when it's soft, there's a chance you might have a short frenulum. So this is a short banjo string. Some people call it a tight banjo string. If this is happening, you might have pain, it might tear when you're having sex or masturbating, and then when it heals, it might create scar tissue, which can then tear and bleed and all over again. It's a very simple procedure to try and rectify that. It's called a frenuloplasty. This is where the banjo string is lengthened, and that should just rectify that situation. There is a chance that some people might have an element of phimosis off the back of that, in which case steroid creams or a circumcision may also be beneficial. But if you think that you have any of these issues, please visit a doctor. You need to be examined, because even though the treatments are pretty straightforward, we still need to be able to examine you to determine what the underlying cause is.